cholesterol medications. We have liver damage, neuropathy, which is a disease of the nerves, severe joint pain and ligament rupture. Oftentimes people come in here and have lots of joint pains. All they have to do is get off of their Lipitor or Crestor, their drugs that lower their cholesterol, get off of that, their joint pain goes away. Now let me stop for a second, just so I'm very clear. I'm not telling you that if you right now you're taking one of these drugs or any drug, I'm not telling you to stop that tonight. I'm not telling you that, okay? I'm telling you you should seriously consider whether or not you want to be on the drug and talk to your doctor about that. Whoever's put you on the drug, talk to them about that and let them know you want to get off of it. And we can help you do the things so that you don't need to be on it. But I want to make myself very clear. If you're taking Lipitor, Crestor, or any other drug, don't go home tonight and not take it because Dr. Sean said it wasn't doing me any good. It's not what I'm saying, okay? Muscle wasting and atrophy, so it affects the muscles. Guess what's a muscle? Your heart is a muscle. It's made up of skeletal muscle, we call it. So here we're taking cholesterol medication that's supposed to be preventing heart disease, but look at what the danger is, heart failure. It seems like we're going the wrong way here when we take the cholesterol medication, right?
It's greed.
Yeah, it is. It's greed. Exactly.
Somebody comes up with something and
yep, if you can make some money on it, yep, you sell as much of it as you can. You're right, Joel. So dangers of cholesterol. It limits our protection from cholesterol against cancer. Cholesterol helps protect us against cancer. Remember we said cholesterol is essential for forming vitamin D. Many research studies have been done recently on the importance of vitamin D, and if we don't have enough of it, it's linked to many cancers. Cholesterol medication, when you take it, risk of depression. The reason that occurs, 60% of your brain is cholesterol. Okay? So if we start minimizing cholesterol, decreasing it, what happens to your brain? You think maybe you're going to get depressed? Most definitely, because depression is a mental illness, right? Stops the production of coenzyme Q10, CoQ10. So if you are on a statin drug, that's the typical class of drugs that would be used to lower cholesterol, Crestor, Lipitor are the big ones. If you are on that, at the very least, you should make sure you're supplementing with coenzyme Q10, because when you take these drugs, it stops the production of coenzyme Q10, which is an important antioxidant, which will again protect you against cancer, protect you against inflammation, which we're going to talk about in just a second, which is a leading cause of heart disease, inflammation. So CoQ10 prevents that, but it's depleted when we take cholesterol meds. And CoQ10 is also very important in producing energy in our body. It makes something called ATP. Don't need to know what ATP is, just know that coenzyme Q10 helps us produce energy, especially in heart muscle. So it's really important for the muscle of the heart. Anytime your CoQ10 levels are too low, you're going to have heart problems. Okay? And CoQ10 is great for a lot of things, but we're talking about heart health today. On the bottom here in red, this is a study that we put on here. The study was done, followed 114 people who had heart disease. They were on cholesterol-reducing medications. And what they found was for every point of cholesterol that they were able to reduce in the blood, so as cholesterol went down, every point, the increase of heart attack rose 36% for every point they lowered it. So again, another study correlating lower cholesterol, higher risk of heart attack. We talk so much about cancer, can't get used to heart disease. I think this is pretty much stuff that I've already covered. Just talking a little bit more about the dangers, but we already covered that stuff. Let's keep on trucking. So you might be asking yourself right now, or anybody that is concerned about their cholesterol being high, you might say, well, should I lower my cholesterol? Should I bother? Or if I am, should I continue to lower it? Now, it is important, or it is helpful to have cholesterol in the right ratio, meaning those LDLs and HDLs that we talked about just a second ago, be in the right ratio, as you want to have more HDL, the good guys, compared to the bad guys. That is important. But if I'm just talking about overall my cholesterol is high, should I lower it? Well, when you reflect for a second, pause to reflect on everything that we've just talked about, you have to ask yourself, well, why would I? Because the studies haven't shown that lower cholesterol leads to any better health. And in fact, studies have shown that when my cholesterol is lower, I have a greater risk of heart attack, greater risk of dying from heart attack, and a greater risk of developing cancer. That was on this last one. I didn't mention that. This one right down here. No, I have it coming up. Never mind. But anyways, it does. Increases your risk of cancer as well. So, should I lower my cholesterol? Well, I would say with that knowledge, why would you? Right? Why would you even be concerned that your cholesterol is high? Here's a quote on the bottom by a medical doctor. He says, it's never been conclusively shown that lowering cholesterol saves any lives. In fact, several large studies have shown that lowering cholesterol into what's the recommended range right now is correlated with an increased risk of cancer, of death, especially cancer. That's the study I was thinking of. So you lower your cholesterol, you increase your risk of cancer, is what that study is saying. So should I lower my cholesterol? Why would you? You know, go talk to your doctor about it. Get me off of this. Why would I be on this? So if it's not cholesterol, high levels of cholesterol, it's the problem. Well, what is the problem? The problem is inflammation. That's the true cause of heart disease. And we talked about the problem is oxidation of cholesterol. Inflammation is linked to that. Inflammation is the true cause of heart disease. So let me explain to you why that is and how it works. Anytime you injure any area in your body, the normal response is inflammation. So again, inflammation is a normal thing as long as it is short term. You know, I sprained my ankle, okay, fine, there's inflammation for about 72 hours and then no more inflammation. That's a normal response. The problem is in our bodies, because of the things that we do, which we'll get into here in a second, we continue to have high levels of inflammation all the time. It never rests, okay? So when you injure an area of the body, whether it's the ankle or whether it's a blood vessel, what happens in inflammation is the area will swell. Okay, you get swelling. So you can follow along with the pictures of the arteries, or you can just watch what I'm doing here. So first of all, the artery swells. So the wall of the artery gets thicker as it swells. Okay? And when it thickens, you can see that the space that blood flows through becomes reduced. Smaller space for the blood to flow through because the vessel is inflamed and it's swollen. The other thing that will happen, or another thing that will happen, is the blood vessel will constrict because when you injure an area, if you nick the artery, because we have those free radicals out there, we damage an artery and now it starts to bleed, we want to stop the bleeding. So the way the body stops bleeding is it constricts the arteries so that it slows down blood flow to the area so that your blood can clot. Right? If we cut ourselves, eventually the blood clots. That's because our body works to restrict the arteries around it, slow the blood volume through there so the blood can slow down, coagulate, and clot, form a clump so that you don't bleed anymore. So that happens in the artery. So we have swelling, so that we're reducing the size of the artery because it swells. We have it closing down to try to reduce blood flow so that we can clot. So that's closing down the artery even further. Keep in mind here, this is where the blood's supposed to be flowing through. Okay? We don't want this thing closing down. We also have things called white blood cells, part of our immune response during this inflammation or inflammatory response. They go to the area, they work to clean up the dead tissue, the dead debris, where the tissue gets injured. In this case, we're talking about a blood vessel. The blood vessel gets injured, the white blood cells come, it carries that away, and then it stimulates the production of new cells to start being created around the area that was damaged. And the new cells are what we call a scar or scar tissue. Anytime you damage an area, whether it's twisting an ankle or you get a nick in your artery or whatever it is, when your body lays down new tissue to try to heal over the area, it does it with scar tissue, a scar tissue formation. We call that scar plaque, or the beginning of plaque buildup in our artery. That scar, that area of injury, is where that oxidized cholesterol will come and clump to. Okay? So, here's the big picture of what I'm telling you. When you get inflammation, it closes down the artery because it becomes swollen, because it wants to stop blood flow. Then it also creates a little plaque on the inside of the artery where you can start to get cholesterol that clumps to it. Again, closing down the artery because now there's something getting in the way. So we have a decreasing artery and now plaque building up and scar tissue building up. Pretty soon, there's hardly an opening at all for blood to flow through. So in any tube, if you close down the tube, take a garden hose, okay? You have a garden hose, there's water running out of it. If you put your finger over it, so the garden hose has an opening that big, and you put your finger over it so there's half the opening, what happens to the water?
Pressure.
Yeah, it sprays way farther because you created more pressure, right? That's what happens here when you have an artery constricting down, you have a scar that's forming, getting in the way, plaque buildup that's getting in the way from the oxidized cholesterol. You have less space for it to flow through, higher pressure, higher blood pressure. We've all heard of blood pressure, right? That's what I'm getting to. This causes higher blood pressure. So you get inflammation, ultimately leads to high blood pressure. Some other things that happen when in this whole story of what's going on here, when you close down the artery, and remember, go back to the garden hose, you cover it up, the pressure goes up, it also comes out faster, right? What it was flowing at before, when you put more pressure on it, it flows faster. That's why it squirts further than it does if you just hold it there. Put your finger over it, squirts further. It moves faster. Well, what happens in your arteries is what used to be nice, what's called laminar flow, or just smooth flow through the artery. You got blood flowing through nice and smooth. Now that you've constricted it and put a bunch of pressure on it so it has to move through really fast, the flow becomes turbulent. So it's called turbulent flow or turbulence, meaning it's no longer smooth flowing through there. You've got water or blood going every which way. It's going this way, and it's coming around going this way. Chaotic, right? I look chaotic up here. That decreases blood flow even more. So ultimately, what all this leads to is a great deal of stress on your heart, because your heart has to work that much harder to get the blood through these arteries to go wherever it's supposed to be. Because if it doesn't get there,
your pulse goes up too.
Yeah, if it doesn't get there, it dies. Yeah, your pulse can go up because your heart's beating stronger and faster. Because what happens if your brain doesn't get any blood? You die. What happens if your liver doesn't get any blood? You die. So your heart is going to try to compensate for this and make sure that every area gets the blood it needs. But over time, that excessive stress on your heart leads to what? Heart failure. Your heart fails and then you die. You have a heart attack, congestive heart failure, you name it. So, we want to eliminate the whole cascade of what just went on there. One other thing I want to talk about that happens here so that it makes sense in a few more slides. Again, with the story of inflammation and the blood vessels closing down and the blood getting clotting through there, because remember, it closes everything down because it wants to clot. The more of the clotting that you have, trying to stop the bleed, the more clotting, the more it's going to lead to possible blood clots that stay in your blood vessels and get caught somewhere. And when a blood vessel gets caught somewhere, that's not good. It gets caught up in the arteries that go to your brain, you have a stroke. If a clot gets caught in an artery that goes to your heart, you have a heart attack. So we don't want blood clots. And blood clots, again, are formed from the same cascade that I just explained. So again, we've got closing arteries, higher pressure, heart has to work harder, it's going to wear out faster, we have more clots forming, it's going to block the arteries even further. So this is bad. Hopefully you're getting the idea. This is bad. I spent a long time on that slide, but I want you to understand that's what happens. So, high blood pressure is a warning sign, right? I went through that whole story to try to explain to you why inflammation is bad and what it causes. And what's the result? High blood pressure. High blood pressure is the warning sign. It's like the dashboard light that comes on that says check engine.